During the pandemic, many patients with chronic conditions have delayed their care. What effect is this going to have on primary care physicians as we move forward?
Yeah, that's going to be a really interesting thing to watch. And on some sense, there's a worry about all of a sudden there's going to be a flood of people. In another sense, you could say, well, chronic disease kind of has this slow roll that happens, and so everyone's chronic disease kind of may have just hit a new curve of getting worse over time faster, kind of in a compounding effect. It's another reason why prospective payment is so important, that if you could actually take care of people in multiple modalities and ways right now, those relationships will compound positively rather than what we're seeing now is the health of people compounding negatively because they're not able to get into a physician's office. So I think again, the power of teams versus individuals are really important in this, because it's going to take the multimodality of a team-based care environment in primary care to help these people kind of get back to a certain level of health. If it all comes bombarding back all at once, that'll be very difficult. Now, part of me also thinks that that's not going to come back anyway. That we're going to that there's a big piece of America that is scared to get out and about these days, especially those with chronic disease and elderly. And so it's going to be harder if we require them to be in this fee-for-service model, that we have to see them physically in our 10 by 10 exam room, that they're just not going to come back and do that, which means that they're going to sit in their house and they're going to continue to get worse and worse and worse and decompensate, which is kind of what we're seeing now in the ERs across America. You don't see all the heart attacks and strokes anymore. People are staying in their home. And potentially, I think we don't know this data yet, but are people having these in their home, or are we seeing a higher death rate in homes because people aren't necessarily getting to care? We're not sure yet, but that's the other thing that could happen. And if that's the case, then if physicians stay in this fee-for-service model in primary care and patients don't come, then again, you're decimating the primary care layer that needs to take care of these people, while you have a payment model that's disincentivizing patients to actually receive care. So it's this double whammy in America that we could be creating.